besides painkillers, how then was your endometriosis managed?
Well, to be honest, after I have visited 5 to 6 doctors, including gynaes, um, you're the first one who told me the term of endometriosis, and from there I did some research about the endometriosis. But before that, like I said, they just gave you painkillers. Whenever you feel pain, just take this painkiller, or give you acrosel, or strongest dosage would be tramadol. But I don't think that works at all because I don't want to rely on painkiller. Then another I find quite ridiculous is when they say, oh, you have this, but you just give birth. Once you give birth, this will disappear, the pain will disappear. So I don't think that's very practical, and it's not something a patient like me would want to know. I mean, if I know, then, but that's not a solution for me, instant solutions, right? So I just find it quite ridiculous whenever I hear that solutions, but yeah.
Yet another point that she emphasized was that yes, you can dump a lot of very good painkillers at someone with endometriosis. It can help take away the pain, but what's more important is controlling the disease state of the endometriosis. These are little lumps and bumps that are present outside the uterus. So how do we stop these lumps and bumps from growing? Because these lumps and bumps, as they grow and as they break down when you're having your menstruation, that is the thing that triggers the pain. So the one way to control these lumps and bumps is to prescribe hormones, certain specific hormones to patients, so that we stop these lumps and bumps from growing. So when you automatically stop the lumps and bumps from growing, the endometriosis plaques from growing, the pain also then reduces. Okay, so that was why in Steffi's case it was very difficult, because the painkillers alone weren't enough, because the disease state wasn't being controlled. She needed something on board that was going to stop the growth and shrink all these nodules back down. Did you receive any sort of hormone therapy?
I actually did. I'm not sure whether Vicen is one of them, but I tried some of the contraceptive pills before I took Vicen. I would say Vicen helps a lot compared to the normal contraceptive pills. Because so far right now, the menses flow, to be honest, it just prolonged. I used to have very heavy flow the first few days, and I literally couldn't work at all. I mean, I couldn't walk, so couldn't go to the office, and hence I need to take MC. but now I had it for 6 months, if not mistaken, and I feel really much better right now. Like, no longer 21 days.
That's great.
But I would say 10 days now.
Okay, so that's a remarkable improvement, where you get to live at least, more than half the month pain-free.
Yes.
Now, you mentioned the drug Vicen. Vicen is one of the medications that can be used to manage the growth of all these endometriotic plaques, and they've been shown to actually shrink back the endometriosis. You also mentioned MCs.
Yes.
Right?
Yes.
And I can imagine getting MCs, especially when you keep going back time and time again with this problem, can be quite difficult. Did you have any feelings around asking for MCs from the doctors?
Yes.
Tell me about it.
So, well, I went to see a few doctors, right? And I needed the MC to be submitted. Well, to a point that I felt bad about myself asking for MC, because as you know, we are only entitled to 2 weeks, which is 14 days of medical leave, right? I took more than that. So to a point that I felt quite disappointed, because I felt that my employer felt I was lazy, and it's like a sign of laziness, but the fact was I was really in pain and I was desperately looking for help to solve that problem. So yeah.